At Dr. Nagler's office, we take pride in, in our website. So very creative, very innovative for our patients. How did you find the website? Very helpful?
It was very helpful. They had pictures of the different procedures he's done in the past, the videos, and I looked at them, and it was pretty impressive. So that's why I decided to come here.
Okay. And tell me, what type of procedure did you have?
I had a bunionectomy, I think that's what it's called.
Bunionectomy?
Yes. And, well, I didn't know it was going to be like a really, really huge scar, but, well, I took my wrap off my foot, and I look at it, you can't really tell it's a scar, so
right.
It's healing up pretty good.
Well, good. You know, Dr. Nagler does a unique incision on the side of the foot, so it's not very visual.
Yeah.
Looking at if you're wearing sandals, flip-flops. So you're looking at on the top, it's not very visual. So a lot of patients come in because of that, because a lot, in the summertime and stuff like that.
I want
a huge scar on the top of your foot.
Yeah. They were wonderful, especially, I think her name was Melissa. She, because of course I had to take a word for a couple of weeks. She filled out the papers, faxed everything over, and then she called me as soon as, she had faxed them over. So that was really helpful. I have to go through the hassle of trying to get them to the insurance company, so that was really helpful. And all the other staff were like super great. Yes, I will. As a matter of fact, I have my second foot that needs to be done. So yes, I would highly recommend him.
Good.
He's great. He makes you feel comfortable, and he lets you know how the procedure is gonna go, and just everything's great about him.
When you met him the first time, I know a lot of patients are nervous having a big surgery like you did, but what was your first impression when he came in?
He came in, he was like, "Hi." He was like, "How old are you?" I told him, he was, "Oh, you're pretty young." And he was, "Well, you look like a healthy young lady." So I had told him what happened, the reason why I'm here. And I explained to him it's kind of heritage because my parents has it. So I guess that's why I have it too. So he explained it to me, because I was like, how this happened? He was like, "Well, it happens in families, or sometimes it depends on the kind of shoes you wear. But in my case, it was family related." And he had,
most cases are.
Yeah. He had an intern with him when I came, and she was really helpful.